Lifestyle management strategies is a vital component of each therapy. 3 of the most universally helpful lifestyle management strategies include diabetes patient self-management education and support, DSMES, medical nutrition therapy, MNT, and physical activity. In addition, smoking cessation and psychological care may be appropriate for some patients. All patients should enroll in self-management education. These educational resources equip the patient with knowledge, skills, and confidence to understand diabetes and be proactive in their own treatment. Providers are encouraged to consider the burden of treatment and the patient's level of confidence education, as well as the level of social and family support. The DSMES needs to be evaluated and reevaluated by the healthcare team at 4 critical time points. A diagnosis, annually, when any new complicating factor arises, including health conditions, change in emotional or living needs, and physical limitations, at the time of transition of care. The DSMES shifts diabetes care to a patient-centered approach that values the patient as the center of a care model and is responsive to individual patient preference, needs, and values while working in collaboration with healthcare providers to meet therapy goals. Both individual and group approaches are effective. The DSMES is associated with increased use of primary care and prevention. Nutritional therapy is an essential component of lifestyle management and is often the most challenging for patients. Nutritional plans are unique to each individual, and there is no one universal dietary change or meal plan that can be applied to all patients. Nutritional therapy is designed to help patients improve their habits in ways that facilitate a healthy body weight, reach goals for A1C, blood pressure, and lipid panels, and delay or prevent any complications that may occur as a result of having diabetes. It is a powerful tool that has been shown to reduce A1C level by 0.3 to 2%. Macronutrient distribution should be based on an individual assessment of current eating patterns, preferences, and metabolic goals. Management and reduction of weight is important for overweight and obese individuals with type 2 diabetes. Sustained weight loss is challenging but has long-term benefits and is associated with sustained improvement in A1C and lipid profile. For many obese individuals with type 2 diabetes, weight loss of 5% is needed to produce beneficial outcomes in glycemic control, lipids, and blood pressure, and sustained weight loss of greater than or equal to 7% is optimal. It can be achieved with lifestyle programs encouraging an energy deficit of 500 to 750 calories per day, or a total caloric intake of 1,200 to 1,500 calories per day for women and 1,500 to 1,800 calories for men. Registered dietitians typically recommend a diet consisting of 40% complex carbohydrates, 30% protein, and 30% fat for weight loss. For patients with a reduced eGFR, the recommendation for protein is 0.8 grams per kilo per day. Another key lifestyle management strategy is healthy physical activity. This goal most often includes an increase in consistent quantities of physical activity. The 2018 ADA Standards of Medical Care suggest structured exercise intervention of at least 8 weeks duration have been shown to lower A1C by an average of 0.66% in people with type 2 diabetes, even without a significant change in BMI. Increasing physical activity and decreasing sedentary habits have many health benefits. The benefits specific to type 2 diabetes management include a lower A1C, improved insulin sensitivity, and weight loss. In order for these benefits to be obtained, aerobic activity must occur for at least 30 minutes most days of the week. Ideally, no more than 2 consecutive days should pass without exercise in order to maintain insulin sensitivity.